Hello everyone. Today we are going to discuss on very important topic pneumonia. Depending upon the present pandemic situation, it is very important for all the healthcare workers to know about pneumonia. First of all, I would like to inform you all that this is my first YouTube video on my YouTube channel, so I seek your guidance and please try to like, comment and subscribe my channel. As a medical or the nursing student, if you really need some of the content to be known by you, please let me know. I will create video and I will try to post. I will do my best for sure. When we receive a patient of 60 years old smoker diabetes mellitus presented in OPD with high grade of fever, right side chest pain, cough and rescue sputum for last 1 week. So for this type of conditions, first of all we have to know what is the causes of sputum secretions, cough, chest pain, pathogenesis of it and complications, so that it will be helpful for us to continue the treatment and nurses responsibilities effectively. So hopefully the video may be benefited to you, so continue. So in this video we are going to look on definition of pneumonia, risk factors, pathophysiology, clinical manifestations, different types of pneumonia, and for different aspects of pneumonia how we are planning to treat the patient with the conditions and what can be expected outcomes of it. Coming to definition of pneumonia, pneumonia is an acute inflammation of the lung parenchyma, often caused by the microorganisms. So pneumonia is an infection in one or both the lungs, which will be mostly affecting the alveoli, the microscopic sacs of the lung, and pneumonia is considered as lower respiratory tract infection. And 12th November is the World Pneumonia Day. During this period of time we will be making awareness sessions to make the people get aware about pneumonia, how deadly dangerous condition it is. So it is inflammation and consolidation of the lung tissue due to an infectious agent. What is consolidation? Consolidation is inflammation in duration of a normally aerated lungs due to the presence of cellular exudative in alveoli. The alveoli will get filled with much fluid or pus, which it should not be filled with any another content in the lungs, because it only carries air. If it gets filled with much fluid and pus in it, then it leads to difficulty to breathe for the patient. I hope now you clearly know the definition of pneumonia. So now we will have a view on how the pneumonia develops. Most of the time the body helps in filtering the organisms. Especially in this, what happens is when the patient will be taking breath, then when the inhalation process continues, meanwhile there may be chances for any infected agent to get into the lungs, into the sterile field of the lung, which affects the lungs and causes infection. Coming to stages of pneumonia, pneumonia do not occur directly as pneumonia. It follows stages such as first stage of red hepatization, second stage where neutrophils, more congestion, fibrin tissue forms in the lung, then which will be followed by gray hepatization of the lungs. Here degradation of red blood cells, fibrinose supplementation, much more exudate can be seen, whereas the last stage is a stage of resolution. Once the pneumonia is confirmed in any of the stage and patient starts taking the treatment, with that, when the treatment helps in reducing the pneumonia, it leads to healings of the lung. Coming to risk factors of pneumonia, it's very simple word inspiration I have given in order to remember for long period of time. Just remember inspiration and elaborate it. You can remember maybe for your whole life, right? So The word is as follows: immunosuppression, neoplasia, secretion retention, pulmonary edema, impaired alveolar macrophages, RTI, respiratory tract infection, antibiotic and cytotoxic inhalation, tracheal instrumentation such as at the time of intubation or after intubation done, IV drug abuses, overdose taken by the patient, or recently any antibiotic administration to the patient. Other conditions such as general obesity, smoking, immobility also leads to they may also have chances to get pneumonia. And another last one is neurologic impairment of cough reflex may lead to the aspiration of content from digestive tract to the respiratory tract. There are many causes of pneumonia. Pneumonia can be by fungal infection, bacteria, viruses, more overdose of drugs, autoimmune diseases. So just we will see in detail about each cause. The bacteria which causes pneumonia most commonly are Streptococcus pneumonia, Mycoplasma pneumonia, whereas less common bacteria which causes pneumonia such as Haemophilus influenza, Moraxella cat. The viruses which causes pneumonia such as COVID-19, which is now presently the most common cause of pneumonia, influenza virus, adenovirus, rhinovirus are the viruses. Mycoplasmas are not considered as bacteria or any virus, but they have traits of both organisms. Fungal agents such as histoplasmosis, blastomycosis, pneumocystis carinii, and protozoas are the fungal agents which causes pneumonia very badly. The other causes which leads to pneumonia is like aspiration of any food content, fluid, vomitus to the patient also leads to pneumonia, or inhalation of any toxic materials, caustic chemicals, smoke, dust, gases, influenza are the rest of the causes which may lead to pneumonia also. Coming to pathophysiology of pneumonia, any of the causative agents when enter into the respiratory tract, it leads to inflammatory pulmonary responses which causes loss of defense mechanism of the lung, which allow organisms to penetrate to the sterile lower respiratory tract, then develops inflammation. This leads to disruption of mechanical defense mechanism such as the coughing and ciliary motility occurs, which leads to colonization of the lung, causes inflamed and fluid-filled alveolar sacs. Due to that, there may be excess exudate accumulation in the alveolar sacs, which leads to difficulty to expectorate by the affected patient. Clinical manifestations or signs and symptoms of pneumonia can be generally sneezing with running nose, productive cough, sore throat, chest pain, fatigue, muscle aches, gray or bluish skin color due to hypoxia. By the pneumonia, all the systems of the body also will be affected, like central nervous system, severe headache, loss of appetite, mood swings, vascular system, low blood pressure. In cardiovascular system, there will be high heart rate, tachycardia, gastric, nausea, vomiting, joint, severe joint ache, systemically high grade fever along with chills in skin, clamminess, cool skin with bluish color, whereas in lungs severe cough with sputum, shortness of breath, pleuritic chest pain. In muscles, patient will be complaining of fatigue and aches everywhere in all over the body. Of pneumonia, it varies depending upon the causative factors. So it can be etiologically infective, non-infective pneumonia, morphologically, anatomical classification, duration of the disease condition, and clinical classifications. So we can go this all in detail. Anatomically, pneumonia can be classified as bronchopneumonia. All the bronchi only will get affected of the lung in this type. Lobar pneumonia, only the lobes of the lung will get affected, whereas interstitial pneumonia involves the area in between the alveoli, the areas will be affected. Clinically, the pneumonia can be classified as community-acquired pneumonia. Another type of it is atypical aspiration pneumonia, whereas hospital-acquired pneumonia, known as nosocomial pneumonia, that can be by non-ICU acquired pneumonia or ICU acquired pneumonia. If patient is admitted in ICU, then there may be more chances for the patient to get ventilator associated pneumonia or else non-ventilated associated pneumonia. So this is brief about the clinical classification of the pneumonias. Pneumococcal pneumonia is an infection of the lung produced by encapsulated bacterium Streptococcus pneumonia. Most commonly, this bacteria causes pneumonia in the world. So coming to clinical manifestations of this type of pneumonia, such as high grade fever, stabbing pleuritic chest pain, malaise, weakness, elevated WBC count, tachycardia, dyspnea, and blood streaked purulent sputum. Coming to staphylococcal pneumonia, which is mainly caused by Staphylococcus aureus, such as methicillin-resistant Staphylococcus aureus, commonly known as MRSA in the medical field. The clinical manifestations can be fever with multiple chills, rales, decreased breath sounds, elevated WBC count, dyspnea, blood-streaked purulent sputum. In case if the patient is having MRSA, linezolid or vancomycin will be added for the treatment of patient. In the anatomical classification, what we have seen first, lobar pneumonia, only the lobes of the lung will be affected. Okay, that may be like right middle lobe, right lower lobe, or left lower lobe, or left upper lobe. So only the lobes of the lungs will be affected, in which peripheral air spaces consolidation. Pneumonia without prominent involvement of bronchial tree. Bronchopneumonia, centrilobular and peribronchiolar opacity of pneumonia occurs here, tend to be multifocal, patchy in distribution rather than localized to any one region of the lung. In this type of interstitial pneumonia, mainly peribronchiovascular infiltrates occurs, which is caused by microplasmas and viruses. CAP, that is the community acquired pneumonia. It is one of the most commonly type of pneumonia. It is infection of the pulmonary parenchyma associated with symptoms of acute infection. There will be many infiltrates on the chest X-ray and auscultatory findings consistent with pneumonia. In a patient who was not hospitalized or residing in the home facility for more than 14 days prior to the admission into the hospital. Aspiration pneumonia, there will be overt episodes of aspiration or bronchial obstructions by a foreign body, seen in case of alcoholism, nocturnal esophageal reflux, a prolonged cessation in the dental chair, epilepsy also. Usually anaerobes will be causing this type of pneumonia. Atypical pneumonia clinically can be diagnosed by subacute onset, fever less common or intense, Minimal sputum. Microbiologically, sputum does not reveal a predominant microbial etiology or routine smears such as gram smear or culture. Radiologically, patchy infiltrates can be observed in the chest x-ray or interstitial patterns. Then by the hemogram, peripheral leukocytosis are less common or intense. To diagnose atypical pneumonia. HAP, which is hospital acquired pneumonia, can be defined as pneumonia that occurs to the patient after 48 hours of admission into the hospital, which was not incubating at the time of admission. It means when the patient was getting admitted, there was no signs and symptoms of pneumonia, but soon the patient gets admitted into the hospital after 48 hours of admission, develops the symptoms of pneumonia. Coming to VAP, ventilator associated pneumonia, which refers to pneumonia that will be arise after 28 to 72 hours after endotracheal intubations. The symptoms can be high grade fever, cough, pleural and chest pain, breathlessness. Additional symptoms including this can be occur such as sharp or stabbing chest pain, headache, excessive sweating and clammy skin, loss of appetite and fatigue, confusion especially in the older people. Then the general symptoms can be occurred such as patient can be febrile, tachycardia, tachypnea, cyanosis, central cyanosis especially, hypotension and altered sensorium, use of accessory muscles for respiration, confusion in the advanced cases can be observed. For the ventilator associated pneumonia, signs of consolidation can be evaluated by dull sounds on percussion, bronchial breath sounds can be auscultated, crackles, increase VF and VR, agophony and whispering as well as pleural rub helps in evaluating VAP, whereas the investigations which can be helpful in evaluating VAP is by the sputum, gram staining, AFB, methicillin, silver stains, KOH mount and sputum culture will be helpful, whereas X-ray helps in evaluating by homogeneous opacity with air bronchogram. HCAP, healthcare associated pneumonia, which includes any patient who was hospitalized in an acute care hospital for 2 or more days within 90 days of the infection, resided in a nursing home or long term care facility, received recent IV antibiotic therapy, chemotherapy, or wound care within the past 30 days of the current infection, attended a hospital or hemodialysis clinic for any treatment if the healthcare provider have not followed any of the aseptic precautions for any invasive procedure done to the patient may lead to healthcare associated pneumonias. And also the diagnostic evaluations can be done and as investigations such as WBC count, blood sugars, electrolytes, creatinine, blood culture, screening for retro, oxygen saturation by pulse oximetry, ABG, ultrasound of chest, Montauk test. The diagnostic procedures can be continued as invasive procedures in that bronchoscopy, thoracoscopy, percutaneous aspiration or biopsy, open lung biopsy, pleural aspiration, whereas the other diagnostic evaluations such as bacterial, antigen sputum and urine, rapid viral antigen detection in respiratory secretions. Serologically, mainly for atypical molecular study, C-reactive protein, serum procalcitonin. These are the investigations which can be helpful in detecting the type of pneumonia so that the treatment for it can be selected depending upon the organism. Which complications of pneumonia, a very precise word I have given like slap her. can remember for a long time, which can be easily memorized. SLAP means S septicemia, L lung abscess, A ARDS acute respiratory distress syndrome, P can leads to parapneumatic effusion, H hypotension, E emphysema, R respiratory failure or renal failure. Coming to prevention of pneumonia, how we can prevent pneumonia. It is very important to give health education to the patient or any of the patient family member, such as there must be cessation of smoking if the patient is a smoker, better nutrition to be encouraged, respiratory hygiene measures, which is very important because it helps in preventing any bacterial, fungal, virus infections, pneumococcal polysaccharide vaccine, inactivated influenza vaccine or live attenuated influenza vaccine can be given to the patient or the children's also in order to prevent any type of pneumonia in the future also. Medical management for pneumonia. Most common drug of choice of the physician is azithromycin, which is a broad spectrum antibiotic which helps in treating bacterial pneumonias. And next we have a pneumovax vaccine, which is given to the especially 2 years of age or older people with any of the health problems. It is recommended for all adults more than 50 years of age. Actually, this is the vaccine which can help in preventing the infection in future, but it do not treat any kind of infections. The other types we can consider in the treatment, as it depends upon the patient condition, such as CURB, which stands for confusion uremia respiratory rate, which is more than 30 per minute, blood pressure less than 90 by 60 mmHg, whereas age of the patient can be 65 or more. We can divide the patient in outpatient and inpatient. If outpatient, the patient have not taken any of the any kind of antibiotic in the past 3 months, can be given for that patient, such as macrolides. Whereas if the patient in the last 3 months received any antibiotics, then fluoroquinolones can be administered to the patient. And whereas if the patient got admitted into the hospital, the patient can be admitted in the ICU or non-ICU. If non-ICU, then moxifloxacin 400 mg will be continued with beta-lactam. Whereas if the patient is directly admitted in the ICU, then beta-lactam plus azithromycin and fluconazole will be given depending upon the condition of the severity of the infection to the patient. Surgical management is very rare. Only lobectomy will be done, that is the pulmonary resection is performed. Indications of the surgical management are massive hemoptysis if no response to the medical treatment, localized malignancies, persistent abscess cavity in the lung due to pneumonia, then only the surgical management is continued. Coming to course, most the healthy people recover from pneumonia in 1 to 3 weeks, but pneumonia can be very much life-threatening. Always keep in mind the mortality rate associated with community-acquired pneumonia is very low in most ambulatory patients and higher in patients requiring hospitalization, being as high as 37% in patients admitted to the intensive care unit. So lastly, I recapitulate my video by concluding that from the starting we have discussed about definition of pneumonia, types of pneumonia, risk factors, causative agents, and pathophysiology of pneumonia and the treatment regimen. So hopefully the video may be beneficial for you. If you really like it, please like, comment and subscribe to my channel. Thank you so much for having such a lot of patience. So these are my references. If you need, can go through it. Thank you.